Assalamu alaikum wa rahmatullahi wa barakatuh. A very good morning in this edition of Health Matters COVID-19 Extra, where we bring you comprehensive health matters issue, looking at both from medically and the holistic point of view. We'll try and encompass as much as we can wellness from what the experts say and what the alternate healing are saying as well. Our first show for Ramadan, welcome to it. We appreciate your time. Please note the new time slot will be now in the mornings at 10 a.m. Alhamdulillah. And our WhatsApp line is there for you to communicate with us. Tell us what your comments, any questions you have and queries. There are some various questions we still need to tackle, and those will be posted to our various specialists and we will handle them in due course. But please do keep us updated on what's happening on your side during lockdown. This is a very unique Ramadan 2020 for us, and this is what we're focusing on today. Ramadan 2020 during lockdown, also highlighting those with chronic illnesses. First, we'll be chatting to Maulana to advise what Islam does teach us for those that are suffering from chronic illnesses during the Ramadan. And we are in a very unique case lockdown. It's not just here in South Africa, it's Muslims around the world that are experiencing this. A little bit later on, to guide us on that topic is Dr. Shuaib Wadi, nephrologist and also a member of the IMA. The IMA also has a Ramadan message for you, so stay tuned to that for a little bit later on. But first, we are going to be playing you what the stats of COVID-19 results are here in South Africa. Take a listen. So the current rate of new cases is 185. Please take note of that. And remember, any flu-like symptoms, 2 or more, which is runny nose, a cough, a tingling in your throat. And as Professor Mahdi also pointed out, it even goes to your taste of smell and your taste buds. If you're feeling very funny, please call your local GP and they will advise you on where to go or visit your local hospital. But as always, the IMA executive member, Wahida Esop, our occupational therapist, will guide us on a slogan for today. And she says, take cognizance of your comfort. What does that really mean? Take a listen.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Wahida Esop, National Executive Member of the Islamic Medical Association. Days to remember. Take cognizance of your comforts, whether they be your automated garage or spacious backyard, whether it be your comfy sofa or sunny patio lounger, whether it be your own room or special bookshelf, whether it be an indoor bathroom or your own space to pray. Are you locked down in comfort?
Did we really realize the comforts that we are in, recognize that and appreciate it? And I think everybody has a different version of what Ramadan means to them. In this essence, some are saying it's a time to reflect. It's a time to pause. It's a time to understand what Allah is trying to tell us. So if you want to share that message with us and tell us what your time for Ramadan is about during this lockdown, please do connect with us via our WhatsApp line and our various social pages. But for now, we'll play you a short video. Please also note Dr. Shuaib Wadi is standing by to answer your chronic illness questions. We had quite an active show the last time Dr. Shuaib Wadi and Dr. Yaqub was online with us. There were various questions about how to manage your chronic illnesses. This one, again, is about Ramadan. But before we do that, let's play you a video by Raza Ahmed, an imam in London, and listen to his message.
This year, because people cannot come to the mosque. We're bringing that flavor, we're trying to bring that flavor of the mosque to their homes. So it's online classes, it's online talks, it's talking about and telling people about the importance and the blessings of Ramadan, what is attached to it. So it doesn't have to be in the mosque. Usually at this time, it's 1 o'clock, this mosque is packed. It's packed. You literally, on a beautiful weather day like this today, you wouldn't even find space in the main hall at all. But as I said before, the Holy Prophet, peace be upon him, has said, the whole world is a mosque for me. So for us as Muslims.
So that is the case around the world. Muslims are not allowed to visit their places of worship, the masjids, the masajids, and so true for other religions. Note the message from government is the coronavirus can be contained. The coronavirus does kill, especially those with chronic illnesses, and that's our topic for today. Stay home and save South Africa. Together we can beat this. That's the message from government. But for now, we'll move to our motivational speaker, holistic psychotherapist, educator and author, Maulana Saeed Malizani. Assalamu alaikum to you, Maulana Saeed, and welcome to ITV.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Shukran so much for your time, Maulana. I think in the state that we are in Ramadan, and of course Ramadan Mubarak to you and your family, all the best as it starts off in this very unique, unprecedented time of lockdown. Maulana, please just tell us what the atmosphere and the feelings are like in the area that you live in during this Ramadan in lockdown.
Firstly, I would like to say Ramadan Mubarak to yourself and the listeners of ITV, all the viewers. And the situation is sad, and because it is different, it is not as we used to be, in all the other days. The atmosphere is very, very different. There is no Taraweeh, there is no congregational Salah. So we can say that people feel that we are missing that spiritual bonding that we were used to have. We're missing the beautiful recitation of sometimes emotional recitations in the masajid of the Quran by our beautiful Hufaz and Imams. And there is no mass iftars where we share the food with the poor and the needy, and people get this opportunity to share with others as well. And we somehow feel that we have been robbed of the spirit of Ramadan. And some people feel that because when we are separated from each other, we feel. These are some of the things that are actually happening. This is my experience. We feel that we are so disconnected, that the spirit of Ramadan is not the same anymore.
Absolutely. So today's topic, we're dealing with chronic illnesses amidst lockdown and fasting during this holy month of Ramadan. What does Islam teach us when one is suffering from a chronic illness, or if you are not well, the advice that we need to take on fasting?
I'd like to also take a small turn from the issue we're talking about health. And I think that one of the things that is not addressed, generally, it's not addressed as much as I think it should be, is the issue of the effects of this law on mental health of the people.
Yes.
Which contributes as well to chronic health. So because we can't separate the two. And because the isolation itself has these effects on mental health, because we feel this disconnected. We are social beings, and we connected from certain people that we need to meet with, and we have people who are actually struggling. We're talking about the poor people are struggling. Maybe some people in the middle class as well are struggling right now as we speak. Because we have this certain percentage of certainty that we live with. When you go to work, you got this level of certainty. At the end of the month, I'm going to get a salary. And now that certainty is dwindling, is going away. Or for some people, it's already gone. And some people are not certain what's going to happen with their jobs or their income and the businesses. So all these things are falling apart, and it affects the mental and as well as chronic illness of the people. So what we need to do is basically we need to turn to the Quran and see what Allah is saying. And because we have so much time on our hands, we have to open the Quran and look at the situations that and other people in the Quran, they came upon these situations. How did they deal with and what did Allah say to them? Because the Quran is a message for us as well.
Mashallah, that's of course a beautiful example, but it's easier said than done, Maulana Saeed. When we take our day, there is this lethargy of realizing we don't need to go anywhere, we don't really need to do anything, so there is no motivation. And as you said, mental health is a real thing, and I think it has escalated during this time. So just as a sort of on a premise and some sort of idea that you can help viewers with how they can possibly schedule their day and also do it in a sunnah manner during Ramadan.
I think that the most important thing is just to have a switch of the attitude right now to change because the situation has changed. We're not used to these sudden changes as human beings. It happens, we get into a shock, we get stressed, we don't know what to do next, we get frustrated. So right now we have to take our positivity caps and put them on and look at the glass and say the glass is half full instead of saying our glass is half empty. That's what we need to do now. And we need to understand, like I said the other time, that we are not locked down. We are not locked down in our houses, but we are actually safe in our homes. And we need to look at the other side, the good things. Those of us who have, we have to count our blessings. And even those who have little, we have to count our blessings and say, at least, alhamdulillah, we locked down, but I'm locked down in a room or in a house, and I have electricity and water, and I can afford this, I can afford that. That's what we have to start our day. When we wake up in the morning and we have sehri, that time we have to be thankful to Allah subhanahu wa ta'ala that at least I have a meal in the morning. At least I'm still alive. I'm not having COVID-19. I'm not diagnosed with it. So we have to start with this positivity. We have to start with gratitude. I think we have to use a lot of gratitude at this present moment. And we have to use again this opportunity that we have on lockdown to connect more with Allah subhanahu wa ta'ala when everything is falling apart. But we're saying at least we still have Allah, and at least we have this time here. One writer said beautifully, he said this is a pause, there's a pregnant pause between the inhalation and exhalation. When we think of that is very deep. That the pause that we actually need, we don't realize we need this pause, but it's a pause we need from the rat race. We always rushing in and out. We will leave our kids early in the morning, and they go to school, we go to work, and we come back, we only come in the evening. We're not bonding as families as well. So we need pause. Basically, our bodies need this. Our minds need this pause, and we need to connect our hearts to Allah subhanahu wa ta'ala. And there is a percentage of vulnerability that we have acquired now because of COVID-19. When you go out to buy your groceries, you have to put your mask on, your gloves on, you're staying away from people, you're vulnerable. You know that you're weak. This virus is so small, but you're so weak. So this vulnerability is actually positive in a sense that, when we are vulnerable, we realize how weak we are and how great Allah subhanahu wa ta'ala. And we will turn to Him and be able to ask subhanahu wa ta'ala, with more conviction. When we have everything and everything is going well, we tend to forget about Allah. Unfortunately, we do that. And, money is flowing into my bank account, and I got the job, everything is secure. But now the security is falling apart. We realize that the only one who can grant us security is Allah subhanahu wa ta'ala. Look at what is happening right now with COVID-19. We have big European countries, even Asian countries like China. These are giants in economics, but we find them, scrambling, trying to get back to their feet. This shows how great Allah subhanahu wa ta'ala is, and He is the one who can actually help us. We need to connect back to Him, and we need to utilize this time as well, even to connect with our families. Like I said, we don't have this connection anymore. This is another thing that we do on a daily basis. Have time, we do talim with the family, maybe read some translation of the Quran, something that we can do together as a family. The fathers, they don't have this time at home. Just go into the kitchen and help the wife now. The opportunity, we don't have, the excuse of I'm busy and I have to go to work, and we're not sitting on the laptop all day. We go to the kitchen, they ask the wife, what are we making today for our breaking of the fast, and help with the iftar as well. And play around with the kids, maybe in the backyard or in the room, whatever the case is. And there's still an opportunity during Ramadan to still connect and help the poor. Look for these organizations that are calling us to help out and, do it in a safe way and go out and still help the people. And another very big opportunity I realized in this month of Ramadan, this Ramadan 2020, is that Allah subhanahu wa ta'ala has given us an opportunity to learn the difference between our needs and wants. We've learned to cut down unnecessary baggage and unnecessary things that we're taking out our money and our time and even our health. This food leads to chronic illnesses as well, the type of foods that we eat.
Yes.
So this is a time where we have to look at the foods that we eat, cutting down because we're budgeting because nothing is certain right now. We don't know what's going to happen next. But I think this is the advice that we take and use on a daily basis, inshallah.
Great advice. Pause, realize that the time is for bonding. Maulana Saeed, holistic psychotherapist, motivational speaker. Your words is apt at this time. We appreciate your time, Maulana. All the best. Give salams to everybody on that side and be well for the rest of the month of Ramadan. Assalamu alaikum. There we have it, wise words from Maulana Saeed Malizani, and he's given some great advice with regards to Ramadan and COVID-19 during this lockdown. There'll be more with regards to chronic illnesses and this time of Ramadan 2020 during lockdown just after this. Stay with us. Welcome back. Health Matters Extra Monday morning, and we appreciate your time. Hope your Ramadan is going well. And for those listening to us across the lands and over the beautiful seas, you can connect with us via our website, that is itvnetworks.tv, and click on live stream. And that's for all the families and friends who do not have DSTV on this platform, channel 347. We please ask you to connect with us via our social media pages and also our WhatsApp line. So tell us what your Ramadan during lockdown is like around the world. What is it like in your surroundings? Who is at need? So we can try and focus on those areas that people the viewers want us to chat about. I'm Khawa Solomon. Welcome to this edition. And we continue with Ramadan 2020 during lockdown on ITV. So Dr. Wadi, a nephrologist, is standing by, but before we do that, note that during the show we'll be playing you various helpline numbers for you to connect with medical staff, individuals, and remember SADC is also one of those organizations that you can WhatsApp. Go onto their website and also look at, how you can be in contact if you are in need of help. We know that many individuals are maybe prone to depression or stress during this lockdown period. So please note that there are various helpline numbers available for you. This is one, and it is free 24/7. Dial *120 *394# and dial these and other websites, especially where the government are concerned, South African government. You can go onto their website, sacoronavirus.co.za, and you can find out more information about how, whether it's social grants, anything with regards to GBV and various other COVID-19 information. So now let's link up with Dr. Shuaib Wadi, our nephrologist and IMA executive member. Assalamu alaikum to you, Dr. Wadi.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Shukran for joining us once again. Please, let's start with the message that the IMA has broadcasted to our South Africans and what we need to know during this month of Ramadan and their message, inshallah.
So our message is for people to obviously it's a difficult Ramadan for us. This is going to be a Ramadan where we are not being allowed to spend time in the masjid, and people are really acutely aware of that. Normally our linkage to the masjid becomes much more strengthened during Ramadan. So I think it's a real loss for the community. Obviously the lockdown is not for no reason. So we're asking people to respect the conditions of the lockdown. Pray the Salah at home as has been recommended by multiple authorities, to perform the Taraweeh at home, perform the Salah in Jama'ah at home with their families, and respect the conditions of the lockdown. And inshallah, once there is release from the lockdown in a staged way, as the government has indicated, there will come a time when we will be able to perform Salah with Jama'ah in congregation at the masjid again. But it will obviously be likely that this will be with some conditions, and there may be physical distancing required. There may be measures which will be required to prevent the spread of the virus. We pray that Allah subhanahu wa ta'ala grants every Muslim in South Africa and around the world the barakah and the blessings of Ramadan, and gives them the goodness that they can get from Ramadan. There are opportunities, obviously, being at home, many people not being at work, to spend more time in the tilawat of the Quran, to memorize parts of the Quran that you may not know, and obviously to link up with one's family. There are lots of educational resources online, tafsirs, histories of the Prophet ﷺ, which one can access online and do together with one's family.
Jazakallah for that message from the Islamic Medical Association. Dr. Shuaib Wadi, as a nephrologist, you are aware of many chronic illnesses that individuals do suffer from. And a last show that we dealt with chronic illnesses, yourself and Dr. Yaqub was quite active with all the questions and answers taking place. So as a starter for Ramadan, what must people know with regards to fasting and their chronic illnesses, and as well being in lockdown?
So, I think in terms of fasting, many of the recommendations won't be different from what they have been in years gone by. So I think people with mild chronic illnesses like mild hypertension, well-controlled diabetes, chronic asthma, and so forth and so on, who have managed to fast in the past and have had no severity or change in the severity of their illness, may continue to do so using the same conditions that they did in the past. Those who are unsure, who have new chronic conditions, they may want to clear it with their medical practitioner, their doctor who's looking after them, find out from them, is it safe for me to fast in Ramadan? So I think the lockdown may not change many of those conditions. Obviously, for diabetics, there are strict conditions as to which diabetics may be able to fast and for which it would be dangerous and risky to them. So that's a group where they have to every year confirm with their practitioner that, especially diabetics who are on insulin, they have to confirm with their practitioner every year whether it's still safe for them to fast. Because sometimes things do change. They may develop chronic complications. They may develop problems which they didn't have before, kidney problems or autonomic neuropathy or something which makes it more dangerous for them to fast. So it's necessary for people to consult with their practitioner and find out whether it's still safe for them to fast. And obviously, for the majority, it may still be safe for them to fast. And there may be some changes in the medication they may need to take, or they may need to do more intense monitoring to make sure that they don't develop complications.
Okay, so Maulana before the break spoke about mental illnesses and how this can, spike during this time of isolation. What should people take cognizance of during Ramadan, and if they are prone to any mental illnesses?
So one of the problems with the mental illnesses, in fact, many other chronic conditions where the lockdown will affect people, is that some people may not have continued their chronic medication. So I think that's very important to point out right at the beginning. For any people with chronic conditions, they shouldn't stop their medication just because they're locked down. It may be a problem for some people to get their chronic medicines filled, especially if they relied on public transport or if they relied on the public health system. But there have been arrangements made in the public health system for people to pick up their chronic medication, to pick up their repeats. Obviously, they should go out with masks and they should maintain social distancing, or if possible, if it's an elderly, frail person, it may be necessary for someone else in the family to collect their chronic medication. And this is particularly important with mental health conditions, as you pointed out. Many of these mental health conditions will seriously decompensate under two major conditions. And the two conditions where they often get worse is if people stop their medication, which they're obviously at risk of doing now. And the second one is if people are stressed. People are stressed by some type of event. And obviously, that's a very stressful time. So both of these situations could precipitate decompensation. So people with, for example, bipolar mood disorder may decompensate and have bipolar, be manic or be very depressed. People with schizophrenia or psychotic disorders may have a psychotic break. And that obviously becomes harder for the family, especially if they're all locked down, and families may find it harder to access care. So I think it's important for people to make sure they take their medication and then look out closely and carefully with their family members to see if they are developing symptoms of psychosis or worsening mental illness, and try and access care early. The hospitals are not overwhelmed at the moment. The lockdown has done part of its job, which is to reduce the amount of cases that we're getting. So we're not getting hundreds of cases. The hospitals are not overwhelmed. Doctors are available. Emergency rooms are available. Psychiatrists are available. I think you should be able to contact your doctor. If you do have a problem, an acute or a chronic problem, don't be hesitant to seek care. You wouldn't want to die at home from a heart attack because you didn't go to seek care because you're scared about COVID-19. So you have to be sensible about that.
Okay, we quickly will link now to a video with regards to Muslims and their chronic medicines and what to do during this holy month of Ramadan. There are some restrictions, so take a listen to this.
In East London, shoppers gather supplies for iftar, the evening meal that breaks the daily fast of Ramadan. And this year, close to the height of summer, they'll go around 16 hours a day without food and water. But at this local hospital, they've noticed a worrying trend. Many Muslims are also giving up doctor's visits and vital medication. Last year, Nula recorded a 20% drop in people attending cancer treatment appointments during Ramadan.
And it's very difficult for us, without having any religious backing, to be able to say to them that actually you need to do what we say rather than, what your religion is saying. So that's really, that's all part of why we've got together really with the community leaders, with the scholars and the imams, so that we're all giving the same message, and that's, be safe and be healthy during Ramadan.
Denying or delaying cancer drugs as well as treatment for asthma and diabetes can be fatal. But the Quran does allow exemptions from fasting to the sick, the elderly and to women who are pregnant. The missed days can then be made up at a later date or paid for as a charitable donation.
If any of you is ill or on a journey, the same number should be made up from other days. The cancer treatment, Islam have to take it very seriously, because this person is suffering from life and death situation. In that case, we always tell people to take medications, because you are suffering from cancer and you are exempted from fasting.
Layla was seriously ill during Ramadan last year. She sought advice before deciding to take her medication.
I had my own personal conflict within me was I wanted to fast. It was common sense to actually not fast, and yes, I knew that I shouldn't, and it came to the point where I didn't. But I just wanted that more further reassurance to actually say, you're fine not fasting, just take your medication.
This year, Layla is fasting once again, like thousands of others in East London. The local hospitals are just praying that this month of self-sacrifice will see people sparing a thought for their health as well as their religion.
So if you are grappling with that idea, if I should fast or not, and you are not feeling well, whether it is blood sugar levels or whether it is your hypertension, and you are a chronic illness sufferer, even diabetes too, you need to consult your doctor. And after the short break, Dr. Shuaib Wadi will advise us, especially knowing that the Islam, our religion, does make exemptions for those individuals who cannot fast. So who do we speak to about that? More just after this. Please do interact with us via our WhatsApp line. Don't go anywhere. Assalamu alaikum. Welcome back. Our last few minutes on Health Matters Extra. I'm Khawa Solomon. Don't go anywhere. As I said, we'll be asking Dr. Wadi around chronic illnesses and who is the best to advise us on fasting or not. But before we do that, in every show of Health Matters, we try and keep you updated and abreast of various helpline numbers that you can connect with. So keep those pens and papers ready. Note that we also have our Dr. IMA message. The IMA and their members have compiled quite a few videos so that you can be inspired during this time. This time around, we'll hear from Abdul Hamid Jalal, a biokineticist.
Assalamu alaikum. My name is Abdul Hamid. I am a biokineticist. Our profession involves the clinical exercise prescription and rehabilitation of individuals with chronic orthopedic and neurological conditions. The world currently faces a devastating pandemic which poses a risk to each and every one of us and is spreading rapidly. Stopping the spread of COVID-19 may take unprecedented changes to daily routines due to self-isolation, but staying fit and healthy through it all while at home is still a priority. Regular exercise, movement, and physical activity is great for your immune system. It is also essential to optimal health and can help reduce your risk of stroke, diabetes, and heart disease. Stop the spread of COVID-19, stay home, stay safe, and stay active.
And these are our real warriors out there fighting while we need to stay at home. And I think every child, every family member know that message already, stay at home. And the message as well to our elderly, anybody over 60, they basically need to be in self-quarantine at least till September. So if you can help and assist any individual out there that is not supposed to be outside, please lend a hand. For now, we chat to somebody that's doing some great work within this lockdown period and amidst COVID-19 is the Giving Without Borders. This NPC has come together, and let's find out what they're doing out there. A very good day to you, Sandra, and welcome to ITV Health Matters Extra.
Thank you very much for having me, and a very good day to you too and your viewers at home.
So Sandra, tell us a bit about Giving Without Borders.
Giving Without Borders is a non-profiting organization which started last year in 2019. The main aim was to bridge gaps in our communities, be it educationally, social, economic issues, and whatsoever needs that the community will be having. So we just step in and help out where we see it fit.
Tell us, which areas do you focus on?
From last year, we have been focusing on education. We've been going around schools, doing motivational talks, career exhibitions, and everything. But then now that as a country, or rather globally, we are facing this pandemic of COVID-19, that is then that we started giving out food parcels to people. So I would say that at this present moment, what we are more focused on is just identifying families who are in need, individuals who are in need, and then we just give them food.
How can individuals contact Giving Without Borders if they need help or if they'd like to donate any goods?
If anyone would like to give help or donate to Giving Without Borders, they can contact me on my personal cell, which is 076 789 2734. Or they can visit our Facebook page, which is Giving Without Borders NPC. And again, our Twitter handle is Giving Without Borders NPC. And as for those individuals who would love to donate, I would plead with them, because one thing maybe that I may bring to light is at the present moment, we are self-funding ourselves. The food parcels that we've been given to people for the past few days, we just took out money from our very own pockets. So we would really appreciate it if we can have people who can just donate to us so that we help feed these families who are in need. Because the one thing that we know is that most of the people did not work the rest of this month. So they are in need. They are in dire need. There are families who are starving out there. We would really appreciate it if they can just contact us and help us.
Thank you so much, Sandra, for your time. And may the Almighty continue using you guys as a way to get food to the needy and desperate. We appreciate your time. Please do follow Giving Without Borders NPC Facebook page, Giving Without Borders NPC Facebook page, and their Twitter handle, and Google them, and please donate generously towards their cause. Thank you so much, Sandra, for your time. All the best. Goodbye.
Thank you.
There you have it. Please contact Sandra, and any of the information that you have missed, please WhatsApp us and we'll send that through to you. Videos that you request, telephone numbers, as well as the helpline numbers we've also got. But you can contact Sandra on 076 789 2734. So note that our next video we'll play to you right now is about Syrian widows who prepare Ramadan meals for their residents in need. Take a look at this.
طبعا معنا الطباخات المتطوعات اللي طبعا فاقدات لازواجهن. هلا فكره هيك مطبخ او الهدف من هيك مطبخ هو افاده هالطباخات هدول اللي هن لتحريك اليد العامله طبعا بشهر رمضان المبارك. يوميا بهالمطبخ بنوزع 300 وجبه، هال 300 وجبه لاهلنا النازحين بالمخيمات، يوميا هلا هو قسم بيروح لاهلنا النازحين بالمخيمات، وقسم راح يروح للعوائل الفقيره بمدينه ادلب ان شاء الله.
So as we know, widows, sometimes they're the ones that need help, but they've come together to help the residents of Syria and cook for them meals up until 300 meals for individuals. So we are also experience a shortage of foods literally on our doorsteps by various individuals. So please connect with them and donate generously. For now, our trauma helpline will be displayed online, on screen rather. And remember that and many other telephone numbers you can get from our Health Matters WhatsApp line. So please note that this number is counselling for all medical staff and those that are in need, as we know that secondary trauma is absolutely out there. So please use this number for them, message them and let them know that there is assistance for those individuals that are healthcare workers that need some counselling. So note that in every insert of Health Matters, we try and put together a mosque in need, and today we focus on Nurul Islam Masjid. This masjid is in Milky Way Ocean View. Imam Abdul Hakim Rabban is been the resident imam there for several years and many years. Please donate generously to various masajids and the mosque in your area. As we know, these mosques are closed. There are no feet coming in, so they need funding and the necessary help to keep the mosque going. So today's feature is Nurul Islam Masjid. This is also in an underprivileged area, Ocean View, Milky Way, beautiful little area in the Western Cape. So please donate generously to them. For now, we wrap up with Dr. Shuaib Wadi and find out who exactly you need to contact when there are advice that needs to be given, whether you should fast or not. Welcome back, Dr. Wadi.
Shukran, thanks, Khawa. So can you hear me?
Yes, please go ahead.
So I think essentially you need to contact your primary care provider, your general practitioner or your doctor. I know that many doctors are not doing routine follow-ups and checkups, and especially for patients who are reliant on the public health system. Some of the clinics have been closed or they've been limited in terms of the numbers, but you can get access telephonically to some of the clinics and to some of your doctors to get advice and information. Certainly, if you feel that you're not sure what to do, give the doctor's rooms or the clinic a call and ask for the doctor to call you back or to give you information. Many doctors are communicating, even doing telephonic consults or consults on Skype or on other electronic and online platforms. So I think if you do need information, try and get hold of your health practitioner and get information.
Okay, so Dr. Wadi, I've heard of a story, somebody's just written into us as well, that their mother, who is quite elderly, went to the hospital because she had some heart pain, and she does have a heart condition. So she didn't realize what was meant to happen or how this works. She was told just to drop her mother off. The mother then waited outside in a tent. It was quite cold, did a coronavirus COVID-19 test, and hours later, while waiting in this outside makeshift area in the tent, it was quite cold, and when a test came back negative, she was then allowed into the hospital, and then they could check her out. What do people need to know when they are going to provincial hospitals or any private hospital for that matter for an emergency? What do they take with? What do they need to know?
So that's a big concern at the moment. Most hospitals, private, public, every hospital is restricting access to the hospital to patients only. I think in really severe circumstances, there may be an option for one person to accompany the patient, but in general, the patient only will be allowed into the hospital. As you mentioned, for the majority of hospitals, they're going through a triage process. Now, that triage process is supposed to pick up patients who are urgent and take them straight into the hospital without waiting. Obviously without waiting for the result of the COVID test. So they will be treated as if they may have COVID, but they should be getting attention immediately. But there are problems with some of the triage processes in some of the hospitals. In terms of what they should take with, obviously, some of the triage tents are outdoors. So the public hospitals like Johannesburg Hospital, Baragwanath, Helen Joseph, they've set up tents outside the hospital to triage the patients before they go in. So it can be a bit chilly. So I think the person should have a blanket or warm clothing, especially they may wait a long time. So sometimes the wait in the public hospital was very long in the casualty. Now it seems that the wait may be longer in the COVID area. But it depends how busy the hospital is at that particular time. If the hospital is very busy, you may end up waiting longer. Most of the triage areas in private hospitals are indoors, in the casualty or in part of the casualty.
Okay.
They may also do a COVID test for you before you are admitted, if they think you need admission. If you don't need admission, they may assess you as they would usually do after screening you for your whatever problem is. If your problem is related to a complaint which could be COVID related, or if you need admission for any other reason, it's likely you will end up being tested for COVID.
Yeah. Dr. Shuaib Wadi will definitely chat soon again. Shukran so much for your time. Always a pleasure chatting to you and the members of the IMA who do some great work out there. Please log on to their Facebook page and various websites to donate generously. Assalamu alaikum to you, Doc.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Any of the numbers, videos, footage, questions, comments, queries that you've missed, please do interact with us via our WhatsApp line. Take it down, save it, and connect with us. From myself, Hawa Solomon, and our team on Health Matters Extra for now, we'll see you back tomorrow. Assalamu alaikum. Goodbye.